Hi, I'm Dr. Jarek Conrad. Welcome to Healthy and Black, where I share information about the state of health for Black America across 7 categories, from emotional health to physical health. I became plant-based over 15 years ago after losing so many of my family members to chronic health issues. Now I want to help you take control of your health. Welcome to this episode of Healthy and Black. I am excited today. We have a wonderful guest that I've been waiting to get on the show. He has a wealth of knowledge about one of the major issues plaguing not only our community, really America at large, but specifically, we have some challenges here that we're going to have to overcome. We have invited Dr. Ted Thomas to come and speak with us. So who is Dr. Thomas? He is originally from Tacoma, Washington. I don't know a whole lot of Black folks from Tacoma, Washington, so we'll have to talk about that a little bit. Maybe that's my ignorance, but I've known Ted now for, it's been about 8 years that I've been here in San Diego. So I've always been impressed by your knowledge and our shared frustration. One of the things that I better talk about is these grandkids. So I know you have 2 daughters and you have 2 grandkids, one just 8 months old. If there ever was a proud grandfather, this is one we're talking to today.
Yes.
So congratulations again
Thank
on that.
you.
I'll tell a little bit about your medical background. You got trained in Denver. You went to University of Colorado for your MD. Fast forward to your time here at San Diego. You went into private practice in nephrology, and we'll talk about nephrology for people that might not know what that means. You were with that medical group, that Balboa Nephrology medical group, up until 2021. You served as medical director for hemodialysis clinics and also the chief of staff at Scripps. And so many of our conversations have been about your experience in those clinics. And you probably, again, have the best job you've ever had. You're retired. You still keep your fingers on the pulse of what's going on as a board of trustee member at Scripps Health here in San Diego. But your biggest job is being a grandfather. We know about that. So again, man, I want to just welcome you here. I'm excited to talk about this really important topic. But anything I missed from your background you'd like to
I
share?
think you got it. Better put in there I'm married too.
Ned would kill me if I didn't mention
Exactly.
that retired school administrator,
Yeah.
Inez, and her and I have had some fun conversations about some of these challenges.
Mhm.
So thank you for pointing that out. So let's dive into it. Let's talk about, first of all, what is nephrology?
Perfect. It's a relatively new specialty, but it's a specialty that deals just with the kidneys. If I have kidney failure, if I have high blood pressure, if I have fluid overload, the kidneys are involved there somehow. So it's a treatment of kidney disease.
Okay. Now, of all the different disciplines to go into, did you pick that as this, here's what my specialty is going to be, or did circumstances lead you how did you wind up specializing in this?
It was clearly circumstances because in medical school, the nephrologists, oh man, I couldn't stand them. I just want to strangle 'em. But when I got to my residency, my first attending physician had just finished his nephrology fellowship. And I loved that guy, And when I did my internship, my next door neighbor was a nephrology fellow. And I thought, wow, I want to be that guy. And so
Okay.
it was just a combination of just meeting people that were just great doctors who were just great people. That's what really drove me to want to be one of them.
Okay. Okay. And then when you got into it, was it something that you developed this passion for?
Oh, I loved it. And there was a lecture real early in my fellowship, and it was a doctor from Cedars-Sinai. And he was showing pictures that were on the wall. I mean, this is before HIPAA was around, so you could actually show pictures of real people.
Okay.
Showing all the people that had contributed to Cedars-Sinai, all the pictures of the emergency room. And he says, you want to see some Black people? Let's go to the dialysis clinic. You're like, holy
Wow.
smoke. And then
Wow.
30% or so, those are numbers back then, 30% of the people on dialysis were Black.
Wow.
And it doesn't matter where you were in the country. If you wanted to find some Black patients, you just went to the kidney failure spot and there you found them.
Yeah. Yeah. I think most people who've listened to the podcast have probably heard me tell my own personal story, most recently with my sister, who was my last remaining sibling alive. And I talked with you during this process when she was struggling and at the end of it all refused the dialysis and decided she didn't want to go through that process. So this is something that has certainly touched a whole lot of us. And we'll talk a little bit about why that is. Why is that the place where you want to go to see the Black people in the hospital? We'll talk about that. But let's step back and let's just talk about kidney disease in
Mhm.
general. Just tell me a little bit about it. What causes it? What are the main symptoms of kidney disease?
It's a real sneaky disorder. That's the problem
Mm,
with it.
mm,
So the way I tried to explain to people was your kidneys aren't just the left kidney and the right kidney. If you cut them open and look in there, there's thousands, hundreds of thousands of filters called glomeruli in each
mm.
kidney. And unfortunately for us, your kidneys kind of work really hard. And once you hit about age 30, they're over the hill. You start to lose a little bit of kidney
Really?
function every year after age 30 or so.
Really?
But there's so much reduplication in there that you can live to be 90, 100 and never have any kidney disease. So you only need about 10% or so of the kidneys working to make it. We used to tell people that we could get rid of your left one, probably get rid of half your right one, and you'll be just fine. You'll be just
Uh,
fine. So what happens is they become like your back. If you really work your back hard, what happens one day? You quit working. So instead of say 1,000,000 glomeruli working, maybe it's 900,000 and they got to pick up the work of the extra 100,000 that are left. If it goes down to 500,000, they got to do twice the work. And then after a while, they just say, forget it, we're done.
yeah.
And so the whole deal to prevent kidney disease is to try to keep them working as long as possible. You can't stop time, you're going to lose them, but to
Right.
slow down, you don't want it to go too fast. You don't want things to go down too fast.
Yeah.
And so the surprising thing is you probably, when you're down to around 20, 30% kidney function, then people might notice something. Okay. Then they say,
Wow.
wow, hey, and this was always a discussion. I'd look at a paper and say, hey, Mr. Smith, your kidneys aren't working great. And he's, what are you talking about? I'm urinating all the time. It's a,
Mm,
that's the problem.
mm,
So it might be extra urine, or it might be not enough urine. It might be your blood pressure is too high. It might be your urine gets foamy. It might be that your legs get swollen. It might be that your urine changes color.
mm.
But it's just so sneaky that it's really the best way to find it is to check a blood test and a urine test, and then you can get your answers.
Yeah, I talk a lot on this podcast about having this intimate relationship with your body, about really knowing your body. And people don't like to talk about it. Watching what comes out of your body and trying to see if there are any changes and if you could recognize the changes that you see and can you associate that with something. When I eat this way, I notice
Mhm.
this is what's coming out of me. If I work out, this is what it is. So that's something I don't think most people pay attention to that, but it's really important to try to
Mhm.
understand what little changes that you might see before they become drastic
Exactly.
changes.
Exactly.
What strikes me is you talk about the fact that, look, we can maybe take away one and a half of our kidney and still be fine. Yet you got so many people that are struggling with kidney disease. That means that their kidneys have
Mhm.
really just been through war.
Exactly. So how we classify it, we would give people numbers. Oh, you're in stage 1 chronic kidney disease, stage 2. The bottom line is if you're less than 20%, you've got really significant kidney disease, really significant. If you've got less than 10%, somebody's talking to you about a transplant or dialysis for sure. Demanding that are really asking you not to think about it anymore, but really
You got to,
go for it, right?
yeah, yeah. That's again, it's so fascinating when you talk about us, you talk about Black people, and while we experience this stuff at a disproportionate rate. Is this a genetic thing for us? Is this a lifestyle thing for us? Why are we seeing Black people suffer from this more than other groups of people?
Yes and yes. And do any other questions? Probably yes to that too. The question always was these are studies. I was in school in the 70s. And studies from the 60s were saying, what is going on here? We'll go to some little community in rural southern state USA where we know that people are eating the same thing. Why is one group getting kidney disease and the other group isn't? And so that was because they're, put your adjectives in, because they're white, this happens, because they're black, this happens. There's so much question about what is black, what is white anymore. Now there's some studies about various lipoproteins. Oh, maybe mom had this lipoprotein, dad had this one, put them together. Man, if I get high blood pressure, geez, I'm in big trouble. Or mom didn't have it, dad has it. Yeah, I'll probably do just fine. So maybe this is something various people from Africa, of African descent, have these various lipoproteins. Maybe that is what it is. Maybe it's just your lifestyle. And now I've developed hypertension. And again, these are really small blood vessels in the kidney, and it's boom, they're being hit with high blood pressure. They're just going to poop out. I don't care who you are, they're just going to poop out. Is it I've put various toxins in me? Yeah, they'll do it too. I've purposely put toxins in me. It's really fascinating that if you said Mr. X was a heroin addict and now he has kidney failure, in your head, you know what Mr. X looks like. Mr. X is not going to be a white person.
Right.
That if a white person uses heroin, he might get kidney disease, but it's a totally different type. So it's got to be some lifestyle. It's got to be chronic disease. It's got to be genetic, and it's got to be stuff that we just don't know what it is just yet.
Yeah. So given that, I'd like to talk to people about, listen, there's a lot of stuff we can't control. We can't control that genetic material that our mother gave us. We can't control that genetic material our father gave us, or
Right.
who their parents gave them. We can't control any of that stuff. We can control the lifestyle issues
That's
to
true.
a degree, right?
That is true.
There are more challenges in trying to live a healthy lifestyle in certain communities. We know that's been well documented. There is a whole system designed for us not to live a healthy lifestyle. People have invested in us not living a healthy lifestyle, right? They make money
Right.
off of us not living healthy. All that's true. We have got to, if we have any hope of overcoming this challenge and any other challenge, we got to take this lifestyle part serious because the one that we can control.
Exactly.
Let me ask you this. You've spent a career talking to patients in various stages of kidney disease, probably some pre-kidney disease that you could see go in that direction. And you talk with them about diet and lifestyle. How successful has that conversation been for you? How effective has it been for you to sit down and have that discussion?
Not nearly as effective as I'd want it to be. That's the problem. That like the sign behind you, there's a lot of, this is what I ate. This is what my parents ate. This is what their parents ate. This is what I eat. I'm sorry. I can't change it.
Yeah.
And we wished always that we could literally go to their home. It's one thing to talk to somebody in your office or on the phone or something. I wish I could have the opportunity to actually walk in the house and go through the refrigerator and go through the kitchen and let me here's my trash bag. Let me get rid of this stuff.
Yeah.
This is not good
Yeah.
for you. And let me show you some substitutes for it. So yeah, it was not nearly successful as you'd want it to be. Even when they're on dialysis, there are sometimes you're like, what are you doing? Come on. So it's a big challenge.
Do you think that do you think that they don't get it when you explain it to them, particularly when they're on dialysis? Like I have a real evidence that something is going wrong with me. Do you think that they just struggle to believe it? That if I make these changes, I can actually get better? Or do you think they know what they need to do? They just resign not to do it? Like in your experience, I know I have my thoughts about it, but in your experience, what has been the most consistent reason that you think people haven't been able to execute on these steps that you're giving them, the advice that you give them? They have not been able to put that into place in their lives. Why not?
I think there's a lot of, this sounds like a horrible word to use, stuff that happens to people that we just
That's
don't
the
understand.
technical definition of it.
That we just don't understand. Like I always remember one of the things we would tell mothers and fathers of children who were developing kidney disease is like, how will we know? He said, talk to the teacher. Which teacher? Talk to the math teacher. Why is
Mm.
that? Because these little things, what does 4 really mean? What does 12 really mean? All those little things, put them together, they can't do it. Their math scores just fall out as their kidney function's getting worse, as those toxins start to build up. So I think one of the problems is you're there talking and they're, yeah, it's going
Yes,
in,
it's
but
wrong.
it's
It's
having
wrong.
trouble. Let me really put this together. Let me put one and one together here. I think that's a big, and again, we'll never understand it because we're not the patient. We're not going through it. So I think that's a really big issue.
Ted, I hadn't thought about that even when I was having those conversations with my sister. I hadn't thought about the fact that they're not able to necessarily process
Right.
information. The whole prefrontal cortex, all of that stuff is not working because you have those toxins in your system. Those
Exactly.
chemicals are altering your ability to process information,
Exactly.
and you become many grade levels lower than what your
Exactly.
actual IQ is.
Exactly.
Which is another reason why prevention,
Exactly.
getting the people early has to be so important. And that is fascinating. I hadn't thought about that. Tell me about this. We'll talk about prevention in a minute, but in terms of treatment, short of dialysis, what do you do when you get patients that are in those earlier stages of kidney disease? What prescription do you write for them?
So before we get to the drugs, it is the diet. I mean, it is the diet.
Yeah.
So sodium, limit your sodium. Your kidneys can't get rid of it. So don't put it in you, because if it's in you and it stays, it holds on to water
Yeah.
and you don't need the extra water. So
Right.
protein. So if I eat a big protein meal, huge protein meal, big old steak, you know, and the body's trying to get rid of it, the flow of blood through the kidneys actually speeds up a bit. That's the last thing you want, because they're already working too hard. And now you have to ask them to work harder. So it's a protein diet that's limited. There's other stuff like potassium, phosphorus. We try to limit those, ask people to limit those. And that's where it really gets tough in diets. Because again,
Yeah.
who thinks about, was there too much phosphorus in this? No one thinks that way. So it's a
Yeah.
brand new way of thinking that we have to go to.
Yeah. Let me ask you about potassium, because one of the things that I usually tell people about is that we get too much salt in our
Mhm.
bodies, and salt helps lead to inflammation. And potassium, in some ways, counteracts the impact of salt. But in this case, potassium is bad for you. Why?
Exactly. So think of your cells as a house, let's say. Okay. And there's some people inside and there's some people outside. Normally, what happens is that there's a whole lot of people, a whole lot of potassium inside the cell.
Hmm.
There's a little bit outside, and vice versa for the sodium. So if I'm doing something and so potassium is actually leaving this cell and going out into the bloodstream, all other doors have trouble closing. So if the cells aren't working, especially the cells in your heart aren't working, ooh, that's a disaster. That's a huge disaster.
Yeah.
And that's the problem with too much potassium. It actually leads to your heart stopping. Now, not heart attacks, but your heart literally stopping. So how do you know you have too much potassium? If you've got way too much potassium, if someone says, "Hey, come here, get out of your seat and come here," you're stuck. You can't move. Your muscles don't work, and you're stuck in your seat. If you have a little bit
Reaction.
too much potassium, you'll never know. You'll
Wow.
never know. But that is about our only emergency. If someone has a really high potassium, if you don't act on that right away, that person's not going to
Problem.
survive.
Wow. Wow. And you can do, when you do your panel, when you look at your blood work, the extended blood work, so not just your
Mhm.
cholesterol and all that, you can check
Mhm.
kidney functions, you can check
Exactly.
potassium levels, you can check, all that stuff.
Exactly.
Um,
Your basic metabolic panel, the usual blood test you get, has kidney function, potassium, sodium in there.
yeah. Yeah. So you can keep, one of the things, oftentimes being plant based, I have some people who are just sketchy about this whole thing. Yeah, I don't know about that. Are you getting everything you need? I heard this story. My neighbor in the place I used to live used to be plant based, and she said I almost killed her because she
Yeah.
wasn't getting the right amount of nutrition. And this and that. Your neighbor just missed the taste of steaks.
Yeah.
Yes, it was killing her that she couldn't
Yeah.
eat that steak she wanted.
Yeah.
But what I tell people all the time is that I try to get my blood work done on a regular basis to make sure that whether I'm plant based or not, how we get
Mhm.
my work done
Mhm.
on a regular basis to make sure things are in the levels that they're supposed to be. And before you end up in a crisis situation, you can see if you got a little bit too much of something or a little
Mhm.
bit too less of something, and you can start to modify a behavior.
Now, mind you, what some people might say is, wait a minute, I can't eat those plants. They are rich in potassium. I mean, that's true. You
Yeah.
cook them a different way. You just cook them a
Yeah.
different You eat them a different way. You can leach, but the potatoes are famous for having way too much potassium in them.
Yeah.
But you stick them in a bowl of water for a little bit, you leach the potassium out of them. So,
Yeah.
so there's ways around it. And there is actually one thing that we're not actually telling people to go 100% plant based. We are telling them when they eat proteins to eat more quote clean proteins. It's much better not to eat the steak. If you want to get 50 grams of protein and get it in a different way. And there's studies that show that people who eat same amount of protein, one is the usual steak and potatoes diet, and the other one is a healthier diet. The ones on the healthier diet, their kidneys stay working longer than the other folks do.
Yeah. Yeah. So if you all listen to what he's saying, when you consume a meal, your body is breaking it down. What the contents of that meal was affects how your system is working. Whether the blood is and nutrients are getting where it needs to, how fast that's working, how slow that's working. And doctors can measure that. A doctor can tell you go eat in secret, you come sit down and have them start to measure what's going on with your body. And they can say, hey, this person had the healthy diet, this person
Mhm.
didn't have the healthy diet. Like that, there's a lot of little things that I say, man, that's evidence enough for me. If that were the only thing I heard, that would be enough for me. This is one of them. You can tell what I ate by how my body is working. Let me ask you this. We have been suffering from this for a long time with the advent of technology, and now you're using Gen AI to create medications and all this stuff. Has there been any recent developments in technology that's helping with kidney disease?
Yes and no. This is going to be one of those slow developing things. The medications are really key now. Back when I was practicing, back in the middle of my practice, these ACE inhibitors were the
Yeah,
big thing, and that's something that pretty much everybody with some disease, some diabetes and hypertension and kidney disease should be on.
yeah.
They have some horrible side effects, and you have to really check blood tests closely with them.
Yeah,
I don't think I can go through a day without seeing a commercial for Farxiga or
yeah,
Jardiance, all these, which are
yeah,
actually
yeah.
being
I
shown to
look,
have.
I know the jingle.
Yes, exactly. And those medicines are actually shown to have, even if you not necessarily have diabetes, might aid in slowing down the progression of chronic kidney disease. So this is a really big change. Wow, maybe these medicines, Ozempic, these GLP-1s, maybe they'll have an effect in that too. That's something. But
Yeah.
when it comes to dialysis, yeah, it's pretty much the same as it was 20 years ago. There's a bigger push for people doing peritoneal dialysis, but there's some
Mhm.
questions about that also. And transplants, there's a big backlog of people who need a transplant versus people who get a transplant.
Yeah.
So I know they're doing stuff with pigs now, and maybe they'll give them more organs. Maybe AI will be able to develop some organs. There's a lot of talk about putting glomeruli in the dialysis membrane. That was a big talk
Mhm.
back when I was in fellowship. We just don't know. So the treatment is still bad. It's not that great.
Yeah, and once you're on it, right? Like you don't start
Pretty
dialysis
much.
and you get better and you don't recover that kidney functioning. All you're doing is stopping the degeneration of it.
Actually, this is the other thing about it. And again, it depends on cause. Like I drank something that was poison and it wiped out my kidney function. Those kidneys might come back. I might just be on it
Right.
temporarily. But yeah, I've got diabetes, high blood pressure, pretty good chance, not 100%, but pretty close to 100% chance of once I'm on.
Yeah.
Now, the reason people are pushing peritoneal dialysis is that we think that any kidney function you have is good.
Yeah.
And you're more likely to lose your residual kidney function when you're on hemodialysis. So maybe we should push people on peritoneal dialysis till they can't do the job anymore. And then we put people on hemodialysis. That was a big talk. Plus, peritoneal dialysis is more physiologic than hemodialysis. But
The people listening, what is peritoneal?
so peritoneal dialysis is where if you were to cut yourself in half at your belly button and just look down, there's a ring of skin, a ring of fat. There's this empty space, and then
I
there's
don't
this.
have a whole lot of that. But I get what you. I get your point, though. Go ahead.
Yeah, and then there's this stuff. There's this lining that covers your intestine, and if you took that lining and stretched it out and looked at it under a microscope and kind of used your imagination, wow, this looks similar to glomeruli. And so what you do is you put in a solution. So you got some sugar and salts in it, and you let it set for a little bit, drain it out, put it back in, drain it out. And what's happening is that at the blood vessels along the peritoneum, they're leaching the stuff out that you don't want.
Gotcha.
It's dialysis that goes on pretty much all day, just like your kidneys are supposed to work all day.
Gotcha.
And then, so it's a lot more physiologic than the hemodialysis where you come in and you get it done today and you might come tomorrow and you're there for a few hours, and it's a lot easier on your body. It's a lot more work, but it's a lot easier on your body.
Yeah. What percentage of people are using that method versus the tradition?
The hemodialysis is still, at least in this country, the vast majority, because when you tell people, this is always the problem I had. You said, okay, this is how you do it. It's real simple. If you can get money out of an ATM, you can do it. You can do it. Well, who's going to do it for me? The patient would ask. Oh, you are. What?
Yes. No, I ain't
Your
doing
wife
that.
is. Your husband is. What?
Yeah. So that's people can't really see themselves doing that.
And a lot of that's the medical profession's fault, because we're telling them we're telling people again what to eat and drink. And now we're telling them to go home and do a life-saving thing. Come on. There's a big disconnect there.
Yeah. Yeah. So back on the eating and the drinking, obviously I talk about that every episode, but what about the effect of exercise and sleep on this process?
Exercise is really needed because again, it helps get your blood pressure down. One of the issues with sleep is that these folks find it really hard to get to sleep, kidney disease patients. So again, their body temperatures might be a little lower than, say, yours and mine. Now, one of the things, if we stuck a thermometer in us when we're dead asleep, temperature's gone down a little bit.
That's right.
And if they don't have that range, so bad sleep is a big problem with these folks.
Yeah. So this again is another thing that it affects so many aspects of your life and overall health. So we want to try to get in front of it as much as we possibly can. Let's say that you unfortunately we weren't able to get in front of it, and you have somebody in your family that's dealing with this. What's the best way for a family member to support someone who's dealing with kidney disease?
I think you just support them with a lot of listening, because they're going to have a lot of bad days. What you really would like them to do is see if they can qualify for a transplant. I'm 50 years old. There's a lot of ageism in transplant, by the way, but I'm 50 years old. I've developed kidney failure, or I'm sure going to want to get a transplant as quickly as I can. It extends your life. It extends your well-being. It's just a much better. You might develop some complications from medications and all,
Right.
but I would take that any day of the week over being a dialysis patient.
Let me ask you about this. You talk about the backlog. I've had some friends who have seemed to find out about the diagnosis and they ended up getting a transplant. And I've had some other people I've heard, they knew about it for a long time. They were still waiting. What makes one a good candidate for a transplant? How is it that some people seem to jump ahead on the list almost? Or am I just perceiving that?
Yeah, I mean, there's supposedly, or supposed to be, I should say, a specific way. You get listed and your number just comes up. But in addition to your blood type, there's various antibodies that you have in your system. I've got a bunch of antibodies. If I get a transplant, it's not going to work because I'm just going to go right against that kidney's going to be seen as a foreign body, and I'm going to
Yeah.
tear it up.
Exactly.
What's my size? There's ageism, there's sizeism too. If I think a BMI of 40, I think was kind of like the 30 or 40. Different transplant centers will have different numbers. But if
Yeah.
you're too big, they're not going to want to do it. If I've had
Yeah.
previous surgeries, I've had lots of blood transfusions. Those are things that kind of slow me down. So if I could find someone who says, yes, I don't want to see you on this. I want you to have my kidney. I might really think real hard about that and to say yes to it. I'd hate someone to do that for me, but
Yeah.
that if you really want to get in the front of the line, you bring a partner with you who's willing to give up a kidney for you.
I got you. Got you. Now, somebody who wants to do that, again, we hear that you only need one kidney. So that's true. If you're healthy, you don't have any issues, don't have any chronic health issues or anything
Mhm.
like that, and you want to be a donor, every surgery involves some risk. But in terms of you being able to live a healthy and fulfilling life with one kidney, you
Mhm.
have no issues with that.
True. You would tell people, make sure you don't have protein in the urine, make sure you don't develop high blood pressure to the donor,
And,
and
yeah,
their lifespan should be pretty much normal.
yeah. Is there a disparity between who gets those kidneys by race or do black people get those kidneys, those transplants at the same rate as whites? Do all groups have the same rates, or there's a challenge
Uh,
there too?
there's a huge challenge there too. 30 some odd percent of people on dialysis are black. Yeah, you go to maybe different parts of the country, it'll be proportional, but other parts, no, it's not. It's not proportional at all.
Yeah,
And why is that? Again, there's a lot of stories about they're not a good candidate. Sizeism. They're
yeah,
too big. They've had too many surgeries. They've got too many antibodies in their system. Antigens, antibodies in their system. So they can't do it.
yeah. So it's another reason I talk a lot about weight, and I try to talk sensitively about weight, so people understand. Look, this is not a judgment about
Mm,
attractiveness or physical
right.
attraction. This is none of that stuff. This is about when you are overweight, particularly if you're morbidly obese or extremely obese, which is typically classified as 100 pounds or more overweight, you just make all the other health challenges that you might have, you're just putting yourself in even more risk. So you're not a good candidate for a lot of other surgeries that might
Mhm.
improve the quality of your life.
Right.
You're not a great candidate for those because of that.
Right.
So it's just, again, it feels like when it rains, it pours if
Exactly.
you're somebody in that situation.
Exactly.
So we're going to keep people out of that situation. So we talked about eating well, we've talked about exercise, trying to get good sleep. What role does stress play in kidney disease?
Oh, I'm sure if I'm under lots of stress, I'm putting out various hormones. Gee, and my blood pressure might go up. These are all horrible things for your kidney function.
Yeah.
So yeah, the less stressful things are for you, the better.
So it's as with anything, that stress is going to exacerbate
Mm,
any problem that you might have, whether it's kidney
exactly.
disease or any other chronic health issue. Let's do this. We talked about a whole lot of depressing stuff.
Yes.
Is there what good news do you have? You've been doing this a long time. Do you have some success stories? Do you have incidences where you've had this conversation with people about, look, you're going in the wrong direction. Let's
Mhm.
get you going in the right direction. And they were able to stay that way long term.
Oh yeah, no, those
So
are always lots of fun. So when their blood pressure comes down, their kidney function stabilizes, they give them the right medications, the amount of protein they were putting in the urine decreases. Oh my gosh, these are just really those are things that make your
yeah,
day.
yeah. So it happened.
It does happen.
Not a
Absolutely.
mythical thing.
Absolutely.
It's possible for people to be able to right the ship. So many of these things, they come down to the same
Yeah.
common denominator: taking care of yourself, watching what you consume, both literally and figuratively. What's going in your mind? How is stress playing a factor? So that's a common thing with everything that we talked about. And then unfortunately, a common theme in everything that we've talked about is this disparity that we have between whites and people of color. Hence, the creation of this show, Healthy and Black, to try and deal with that disparity a little bit. The whole thing is very fascinating. What closing thoughts you have? Anything you were hoping to cover that we haven't talked about as it relates to this?
I think we got it. I think the main thing is that it's not inevitable that you're going to get kidney disease. It's not inevitable that you're going to get uncontrolled hypertension. None of these things are inevitable. And many of these things, or all these things, if treated aggressively and early, you won't hurt yourself. You'll be fine. You'll be fine. But the main thing is there's some lifestyle changes that probably are going to happen. And you just have to be open to those.
Yeah. So I heard, man, I can't remember his name, but there's a doctor that was in the documentary Eating You Alive with me, and his quote stuck with me. I think he said, "Your DNA is not your destiny."
Right.
Your DNA is not your destiny. Your probability of somehow ending up with one of these chronic health issues might be higher because of that genetic makeup. But we're talking about small numbers. You still have so much room here to change your fate. I just can't imagine having to go and do the dialysis. Like, I just can't imagine that's going to be a big part of my week every week for several days for the rest of my life.
Exactly.
If there's something I can do about it, I got to be trying to do everything I possibly can.
Right.
To keep that from happening. Dr. Thomas, I appreciate it, man. I knew, again, that this would be an interesting discussion. It's sobering, though. It's really sobering. And I'm just hoping that people are tuning in to shows like this because they want to change the story for their lives and other people's lives. And folks like you are giving them the information they need to make that happen. So I want to thank you so much for being a guest on my podcast.
Thank you for having me. One thing I always would tell patients is, when I walk in the room, it's not good news. They're calling me in to say hello. I've got some bad news for you.
And you're a nice guy and all, but stay away. You don't want to see us.
You don't want to see me. But I hope that what I'm telling you isn't horrible news, that we can make some good changes that we don't affect your lifespan as much. Your lifestyle is going to probably have to change, but your lifespan, we're working to make it stay the same.
That's right. That's right. And as your lifestyle changes, man, there's so much upside, not just in terms of what your numbers are going to look like, but your quality of life. People underestimate just how much fun they could have exploring new ways of eating and being and thinking. Folks are not looking at that experience as, man, this can be positive. But man, I'm telling you, you start down that path and you start exploring and learning. And I've certainly seen people change their lives around, and they talk about nutrition more than me now. Listen, thank you so much for tuning in. So we'll look forward to seeing you on the next episode. But at this point, you can probably say it with me. Until then, don't let culture, cost, or convenience ruin your health. Thank you so much for tuning in. Thanks for joining me for this episode of Healthy and Black. I'm your host, Dr. Jarek Conrad. If you have feedback on today's episode, please email info@jarekconrad.com. I'd love to hear from you. Don't forget to visit jarekconrad.com to subscribe to my blog. Thanks for listening. Please tell your friends about the podcast. Until next time, don't let culture, cost, or convenience ruin your health.